So thank you for the introduction. So like he was explaining, so I was diagnosed with MS 7 years ago while I was a medical student at McGill University. So I remember it well. So I was just starting my clerkship, which some of you may know is sort of the more intense, stressful time of medical school. It's when you're sort of leaving the classroom and heading into the hospital. So I remember I was starting my surgical rotation, which again is one of the more stressful rotations. So I was working about 80, 90 hours a week. I was in call 24 hours, like every third or fourth night. So it was pretty easy to just sort of, put to the side a little numb spot that it was developing on my left temple. But throughout the rotation, it got worse and worse. The numb spot grew more and more until it was covering the full left side of my face. So eventually I knew it was kind of time to get it checked out. So I was lucky that I had a colleague doing a rotation in neurology, so they set me up with a neurologist. I saw one pretty much right away. He sent me for a CT scan. That was normal, of course, and then sent me for an MRI. So I remember I was studying for my surgery exam for the end of the rotation. It was the next day. I was in the library, and I got the call for the MRI. So I went in, had the MRI, went straight to the neurologist's office. And I remember telling him, like, listen, we got to sort of go through this quickly. I have a big exam. I'm stressed out. And he was like, listen, why don't you sit down? And so then he told me, the MRI showed these demyelinating plaques that was consistent with the diagnosis of MS. So that was obviously, pretty tough news for a young guy kind of going through medical school. It was pretty devastating at first. But, through my studies, I knew that MS was a pretty variable disease. You never really know what the course is going to be. So talking to my friends and my family, it really kind of, I felt like I was ready to take on the challenge. So I started exercising a lot. I started, trying to be mindful of my health, eating better, doing all the things that I wasn't really doing as a medical student just because you don't really have time. I thought that things were going well, and it didn't hurt that I had a 6-month elective in the Bahamas, 6-week elective in the Bahamas to help sort of, get my mind right. So when I got back to Montreal from the Bahamas, I was running on the treadmill every day. But I started to notice I was, starting to have trouble with balance on the treadmill. I was going from 40 minutes every time to 30 minutes to 20 minutes, and so eventually I just realized that it was time to get checked out again by my neurologist. So I went back in. He sent me for another MRI. I went back into his office, and he basically explained to me that my MS had progressed in 6 months what a normal person would get in about 5 years. So it was a pretty rapidly progressive case, and he told me that I'd be in a wheelchair within 1 to 2 years was his guess if I didn't do anything sort of more aggressive. So he told me about a clinical trial going on in Ottawa where they were offering a bone marrow stem cell transplant as a therapy for MS. Sorry, I have a bit of a sinus infection. I'm losing my voice. I decided that was probably the best way to go. I put all my effort into getting into that trial. And eventually I was able to meet with the doctors there. It's Dr. Friedman and Nantel in Ottawa. And so they explained to me basically all the risks and benefits of doing the procedure. They basically explained to me that there was a 5 to 10% mortality involved, which I was okay with. My parents were probably a lot less okay with that, but it's a different story. But ultimately I decided that it was the best way to go. And I was actually the 19th person ever to do the transplant. So, the transplant was definitely, it was really, really tough. I was admitted in the hospital for about 6 weeks. I went through 10 days of intense chemotherapy. After completely ablating my immune system, they re-infused stem cells into my body that basically rebooted my immune system and in theory kind of helped stop the MS, in which actually I was lucky enough that I haven't had another attack since doing the treatment. So since doing that treatment, I was able to, about 3 months after I started writing all my exams again, I was reaccepted into medical school. It was definitely a tough year going back to medical school, but I was able to complete my fourth year. finished all my exams, and did my 2 years of residency, and things have been going great. So now I'm actually practicing as a family doctor in the West Island of Montreal. Thank you. You're embarrassing me. So I definitely still have some limitations. As you can definitely see walking, like I have trouble with balance, I have trouble with fatigue. Every time I walk into a room, I have to scan to find the nearest bathrooms. They're right outside to the right, in case anyone's wondering. But the key for me is that I'm able to live my life the way I want to live it. So talking to a lot of MS patients, basically the biggest frustration is always that they're trying to go back to the way they were before they were diagnosed with MS. And I think if you do that, you have no chance of becoming happy. So for me, I used to ski, I used to be a big tennis player, I played basketball, I played squash, and I'm not able to do those things anymore, but I am able to swim, I'm able to exercise, I'm able to sort of do other things. So there's ways to sort of get around it, and that's kind of the key for patients, I think. So yeah, like I said, I'm able to do what makes me happy. I'm able to exercise every day. And just a quick little tangent, exercise for MS is, to me, the most important thing. The medications, all that is obviously number one. But in terms of what patients can do, I think exercise and eating well, mindfulness is really the most important thing. You can do. Yeah. He knows. So yeah, on top of that, I'm able to do other things that I love. Like I just got a new dog that I'm able to walk every day. I got my scuba diving certification in Hawaii, which was awesome. It was a lifelong dream. I'm getting married in a month, so life is good right now. So just to end off, I was extremely lucky to be able to receive the treatment that I did, but I definitely recognize that it's far too dangerous and far too costly to be more widely available for other MS patients. So my only hope is that the clinical trial that I was involved in, among the countless others that are out there, will lead to a better understanding of the disease and more targeted and widely available therapies. But in the meantime, my advice to patients is just keep pushing. MS is a devastating disease. It takes away your sense of control over your body and ultimately your life. In my experience, the best way to fight is to take control and take charge of literally everything you can, and to quickly learn to accept what you can't control, because otherwise you're sort of fighting an uphill battle that you're not going to win. And really, the key also is to stay as positive as you can. So good luck to all you out there, and thank you very much.